All right, Miss Flo, we are live, and we're praying to the technology gods, to the online gods, that we can actually have a good show, because I know technology sometimes fail us. But Flo, let me just first say, it's so awesome meeting you. In
Yes.
After what, maybe 4 years as online buddies on LinkedIn, we
Yeah.
met through a good friend Lisa Lang, but we've been following each other's journey for the last 3 to 4 years. So it's really exciting for me to meet you today on our Tea Talk. So it's only just get clear the air with that. So welcome.
Wow,
Welcome.
this is exciting. Thank you. Thank you for inviting me. It's quite an honor.
Well, I couldn't think of a better person when I thought of this particular topic, because not only are you DEI, you're tech, you're a
Yeah.
lawyer. And as I was looking at your profile, I'm like, how busy are you? So you won the New Hampshire Business Review Outstanding Women in Business. You're the LinkedIn Accelerator Program Tech and Innovation Creator alumni. You're featured in New Hampshire PBS, the state we're in. You're a director and a producer of a show. You are the DEI director. I mean, I could go on and on. People
Right.
just follow her online, okay? But today we want to talk a little bit about AI. But before we talk about AI, can you tell us about the DEI initiative, your latest adventure that you began this February?
Yeah, so I'm really excited to be a part of DI Directive. The company was created a couple of years ago by my good friend, Malobi Akache, who's also a lawyer who pivoted into technology. And I recently joined in February as a co-founder and chief operating officer. And one of the things that we're passionate about is diversity, equity, and inclusion. And what we're also passionate about is helping organizations who launch strategic initiatives to really kind of hold them accountable
Mm.
and help them really assure that those strategic DI initiatives that they're launching have an impact that's long term and sustainable and measurable. So we are a tech company. We are a DEI tech company that's helping organizations leverage technology, specifically data analytics. It is important for organizations when they're trying to launch DEI initiatives to really do it based on the information they have, right? It can't just be we need more Black people, we need more women. No, but why? What is making you say that? Is it your numbers that you're showing you don't have enough diversity? What is it? So we want to help organizations be more strategic when they're launching their DI initiatives, as well as be able to keep track to assure that those initiatives are actually working. Are you talking to your employees? Are you sending out survey? Are you even compliant? There's that compliancy piece with federal agencies. So we are an end-to-end comprehensive DI intelligence platform. We're a software company that's doing DEI. So I'm really happy to be a part of the organization.
So I'm going to have to bring it back on about the DEI piece, because that's a huge initiative that we're undertaking at Total Health, where we are launching our Seek Color workshops. And I know I shared with you a little bit about that, where we're trying um, to address the inequities and the disparities in care, right? And I know
Right.
underrepresented groups, and I know it's a big conversation, but it starts with DEI and understanding cultural differences, etc. So I'm going to bring you back to talk just about DEI. But one thing you said too, before I start talk about the AI and healthcare, something that you said, because DEI is a lot of it emotes a reaction, right? It brings a reaction, whether for or against. And for some people, they're saying it's ineffective, it's not being done well. Some think it's just an add-on, something that
Mhm.
you're required to do, but there's really no heart. So I'm glad when you said that. Why are people hiring Black people? Why are they hiring more women? What is a strategy? Is it just to check a box, or is there a business case for it? So I could literally
Right.
veer off into that, and I don't want to, but I really could, because I would love for you to talk through that and bring
Right.
understanding about the importance of DEI when DEI is done right. But for today, I
Right.
want I want to touch on your tech brain now. The tech piece of what we're going to talk about is AI. You
Right.
know, we know about Chat GPT. There's a bunch of others, but Chat GPT seems to be the menace and the savior at the same time. So
Right.
before I talk to you about the impact on healthcare and a post that I did recently, talk to me about what are you seeing with Chat GPT and other AI products. There's a lot of fear around Chat GPT and others taking away jobs in every industry. So I'd love to get your take on it from a tech perspective.
Yeah. I mean, it's like with anything. I mean, I remember somebody saying when the typewriter came out, I bet there was a lot of pushback and people, like, oh, what is this? And even when the first computers came out, there was some type of a pushback. I think what it is, there's a lot of issues right now with some of this AI that's surrounded with how they collect the data. Where is the data going? So there's a lot of data privacy issues that are being brought up, especially with something like Chat GPT. When Chat GPT originally came out, it was like, hey, by the way, when you use the platform, we want to let you know that what you type in, we use it and we use it to train our AI. So we're taking your data and using it, right? So it's not private. Beware your data is not private. But there has been some changes. Most recently, now with Chat GPT, you can shut that part off.
Oh,
If, yes, yes. If you do not want them to use your data, the stuff that you type into the chat box to train the AI, you can go in your settings now. You can go in your settings and shut off your chat history.
oh.
So yes. So that is new. So that is one major concern. But I think that it's new data. It's
Mhm,
new technology and it's coming out at a rapid pace.
mhm.
And there's really, when it comes to I can't even talk, regulating that AI, right? Regulators can't keep up with the pace of the AI coming on the market, right? So it's also a thing of what the technology can be used for, which has given some people heartache.
Mhm.
Teachers, for example, professors, educators are really, how do we decipher between something that's written by our student versus something that's written by Chat GPT? However, there's technology that's coming on the market to combat that, where
Mm.
teachers are able to use AI technology that will try to help them verify if a student used AI technology to write their article, right? So we have to, I caution some who are kind of like, hey, we need to ban it. We can't have our students use it. Why I caution against that is that because of this new technology, there's also new jobs that are coming on the market. And some of these new jobs and job descriptions, they're actually looking for people who know how to use AI. So if
Yes.
you've seen that come on the market?
Yes, I didn't want to cut you off because it's so interesting because you said something, a few things here, Flo. You said, which I didn't know, because I use Chat GPT. I do. I like it. You said that before before today, I didn't notice that what I type in was being used, but I can
Yeah.
now turn that off in my settings, not to use my data to clear my history. So that was good information for me today. So I really love that. And also, what you're just telling us now too is the AI to detect AI,
Right.
which is crazy, but I can see why that's also important. So that was news too. So your take on it is it's like when the typewriter came out. It's new
Yeah.
technology. People are afraid, but it's here to stay and it's here to
Mhm.
enhance, our existence. Now, the post I was talking about where they asked these patients asked these questions, and so there were the doctor's answers, which is typically very clipped and to the point, and then the AI answer was shown to be more empathetic. So
Mhm.
75% of the patients preferred the AI's answer, and there was a bit of there were pros and cons. There were people on the post for and against um, that, and they were giving reasons why the doctors may not have been empathetic because of the time restraint, etc. My
Right.
concern is that people will start to go to the AI for medical questions, and if
Right.
our doctors don't get more empathetic. I don't know, what are your thoughts on that?
Right. So just to address, somebody said, well, first of all, what is, this chat GPT? What is this AI in the first place? So chat GPT is essentially a chatbot. It's what they call generative artificial intelligence, which you essentially type in a command, tell me a story about, rainbows, you know, and, the chatbot will essentially, tell you the story or create the story. So that's essentially in a more simplified way of what this chatbot can do. There are other capabilities where it can write code,
Mhm.
and now that you can actually uh, use plugins to connect to the chatbot. So like you can connect it to your calendar and other things like Salesforce, for example, to automate processes. So when it comes to chatbot for medical use in your scenario where it's been a bit more empathetic, we've got to remember that OpenAI, the creators of ChatGPT, display warnings
Mm,
about ChatGPT, and one of it is that it can provide information that is not accurate, right?
right.
So there is that danger of, if people start going to chat gpt for trying to do personalized diagnosis of ailments. Hey, I feel abcd, do I have cancer? um, that's probably not going to be a good choice, right?
Mhm.
Because AI is not 100% accurate, right?
Right.
And what you type in is really what you describe. Might yield accurate results, and it might also yield false results. At the end of the day, it's not a doctor, and you
Right.
really can't, what I mean, you can't really get a cancer diagnosis from a chatbot. So it's you're right in what you said in regards to somebody saying, doctors are on a time crunch, right? And I
Mhm.
see that all the time. I've had billing disputes, for my own, where they had said, well, we're going to charge you extra because you asked this extra question when you were talking to the doctor. And I'm like, are you serious? I thought it was my annual checkup, So now I'm hesitant in regards to the questions that I want to ask my own doctor, because I don't know if I'm going to get charged extra. So yeah, I might feel like maybe I should just go ask chat gpt. um, but again, I think that's shows us a bigger problem. It
Mhm.
shows us a bigger problem of our healthcare, and what doctors should do, right, should not deteriorate that patient care, whether it's the doctors or the nurses or the physician assistants. That patient care should not deteriorate. So maybe there are some things that can be automated. There are
Right.
some things that can be automated that can free up time for a doctor to have more one-on-one time with the patient.
I
So then that,
agree.
you know what I mean? That brings up a new debate. What
Yes.
is it that we can actually automate?
I think that's a great opportunity. I yes, Chat GPT or whatever should never replace doctors care, but we have to address the issue the deeper issue, like you said, of the crunch time that the doctors are having. So they're not able to give patients the empathetic care that they're looking for. So yes, rather than throwing the baby out with the bathwater, is to, like you said, look and see how Chat GPT can be integrated in the back office to give doctors more time. Now, Sarah brought up a great question, and I wanted to ask you this. I'm so glad you mentioned it here.
Yeah.
I often hear about the AI having inherent biases. What is that? Because she was saying the scenario she has here, the doctor asked the nurse to meet at a certain time, but the nurse was late. What should the doctor do? That's what it was asked of the Chat GPT. The Chat AI said he should tell her that she was late and it affected his schedule.
Right.
Her point is that gender bias is not being used in Chat AI systems. Now, how do we prevent this for racism, ageism, etc.?
Right.
I've already been hearing about the racial biases. So what are you hearing about that on the street?
Yeah, so I mean that's a fantastic question, because if we look at what I think what Sarah wrote, the chatbot assumed that the doctor was a he and that the nurse was a she, right? Because we do have female doctors and we do have male nurses.
Right.
So here's the thing: AI is trained by humans. The AI does not train itself; it's trained by humans. And sometimes in that scenario, you might have humans who have unintentional or possibly intentional biases. So as they're building the AI, creating the algorithms, which essentially is creating the language that allows the chatbot to respond back and forth to input, output, right? You could have someone who has, again, unintentional, intentional biases against women or against people of color or other racial and gender and demographic biases. So it starts from the beginning, right? It starts from the beginning of when the AI models are actually being created, that we've got to make sure that from the engineers to the data scientists, whoever is working on the AI and building the structures for the AI are not, again, unintentional or intentionally creating those biases in the system, right? And this is where people who are actually starting to use the AI need to vet and ask those questions. How was it created? And actually test the system, before it's fully launched and integrated into your network, to look out for these potential unintentional or intentional biases. It's like anything else. When you go buy a car, you get in, you test drive it, you're testing everything to make sure it suits your needs and what you're looking for. Well, purchasing an AI system should not be any different. You've got to vet it. It's not perfect. We know it's not perfect.
I never thought of that. I never thought of that you could actually test the AI. What I'm going to probably do that now. Test the AI to see if it answers with any type of, just like the nurse example, any type of race or gender, or I'm gonna really try that. That's interesting. Samuel was saying yes, AI. Some oncologists are saying it is a better solution for their work. So this is good. This is good that we could embrace that. And then Peter says, I'm wondering if you think AI technology will be used more or less in the community setting as opposed to larger academic centers that have the money to invest in this technology. Do you want to take that one?
I mean, so I think what we're seeing now is the market is blowing up with an abundance of AI solutions. And when the market is busy, I think that actually is great for consumers, because that means that, there's going to be competition. And because there's going to be competition, you're going to have competitive pricing, right? And so far, what we're seeing right now, for example, with OpenAI, they still have the free version. Right. They still have the free version that people can try out. And what I see with a lot of these other competitors that are coming out onto the market as well, they will offer you to try out the system free for X amount of days. So being somebody who's in technology and somebody who sells a tech software solution, I'm talking to small companies, to mid-sized companies, to enterprise companies, right? And companies want solutions. Companies are trying to get away from the manual ways of doing things, right? Companies want to automate things and be able to free up time for their staff. If whether their staff is their nurses, their doctors, they want to free up that time so that their employees can be working on other things that are a bit more critical than putting together a report, right? So I definitely see the need for organizations who want to implement AI and are willing to invest the money in AI. And because there is an abundance of it on the market, there are competitive solutions out there depending on essentially what you're looking for.
Right. Sarah says, I love that Flo defines that they're a tech company working in the DEI space versus a DEI company incorporating tech. She said it was super smart differential. How do you see it?
Thank you.
How do you see
I
it?
love that.
So
Thanks, Sarah.
how do you see it? Because I know you explained at the beginning, what you do,
Yeah.
but yeah.
No, we're a tech company. That's what we are. And that's how I always introduce myself when I'm talking with clients or when I'm answering that question. So, what do you do? The first part of that question is always, what do I not do? Because I do a lot. And then the second part, is then, hey, I'm a techie and I work for a tech company and we do DEI. Because we don't just limit what we do to just DEI consultation, but also educating organizations on how to leverage technology, specifically data analytics, to implement measurable and impactful DEI initiatives.
Flo, one more thing I wanted to talk about with the healthcare and the AI. One of the comments on the post that I was talking to you about, they referenced an incident in China where a woman, I guess it went viral, a video was shown of a woman who was beating up a robot because I guess China is transitioning more and more to robots for medical care. And I'm wondering, and so there was and I guess France was having some issues too because they're using more AI, more of that type of technology. And I'm wondering if you see that as the future, near future here in the US. I mean, China, the woman was upset because she didn't get a real person for her healthcare needs. So she was destroying the AI or destroying the robot. And the sad part was that because she did that, she's now in the system as someone who might be denied access for even future health care. But I say that to say, do we see that process coming here to the United States where we're going to be seeing more robots at our local clinics?
So we already see it in surgical surgical robots that are actually assisting in surgery, which are cutting down the time and a little bit more precise. They're trained to be a bit more precise when it comes to some of the surgeries. Like I remember seeing a video of like a knee replacement, for example, and the doctors really needed to be precise exactly of where to cut and how it takes them longer, to really measure everything and just pinpoint everything. But with the AI, when it's trained and, the robot can do it faster and be more precise. So we're already starting to see, especially in surgeries, where they are starting to use AI as an assistant. I like saying as an assistant versus a replacement. Is it possible the future can be where maybe instead of a nurse doing the first, because when you go in, for example, it's your annual, it's going to be the nurse. They're going to do the part you hate the most, which is getting on the scale and then telling you your weight And, and then they do your blood pressure. But just that part itself, just that part itself. Imagine it just being a robot. That part, right? I mean, I don't think you really need a person to say get on the scale. I don't. That's not very complicated. So imagine now that you have the robot. And excuse me, I did not time myself very well because my daughter just came home from school. I gotta open the door real quick. The life of a mother. Give me one.
Sure. Well, while Flo go to open the door for her daughter, we'll continue the conversation here with ourselves and our audience. I guess, Peter, you're actually seeing community cancer care being more interested in AI because they are forced to optimize due to limitations of that format practice versus academic that has more resources and can have the perception of your individual capabilities. No, I know you're back, Flo, and we'll wrap up in about 5 minutes. But yes, continue on. You were talking about robots could be used to replace the preliminaries of the nursing.
Right. That would be an example of where I can see just that limited function in terms of, because right now there's a huge shortage of nurses. My mother, for example, she's a nurse and she's getting called left and right all the time, getting ridiculous offers to essentially, come in and at other facilities that are looking to hire her with all these sign-on bonuses. So there is a shortage. So where there is a shortage of labor, I could see that as an opportunity to be able to use the robots, for example, AI-assisted robots. However, do I see where it's fully doctors being replaced and now the robot being the primary care provider? I don't think so. I think we're still far away from that. Assistant, yes. Replacement, no.
Yeah. We'll kind of come to the close of our talk. Or I mean, I could stay and talk for another hour on AI and all of the implications, because when you're talking about perhaps replacing some of the nursing duties, I know some nurses might be like, oh my God, that's my job. But what we're talking about really is there is a nursing shortage, and where we can use AI to complement the doctors. And someone said earlier in the feed, where when we have more help, we could have less disparities in care, because doctors have more time for their patients. I mean, I see the whole AI as a win, robots as a win. And Sammy, who's an exercise oncologist, she said here, I would love to see if it was past that scale weight. I hate it so much too. And understand body composition or function for truly understanding patient performance. Flo, it was wonderful having you. And we have a tradition here on T Talks, right? So T Talk is a play on the word T cells, which is the happy cells in our body that fights cancer. So we like to end on a high note. So leave us with a great takeaway on AI, tech, whatever. Leave our audience with like something that's going to inspire us or uplift us.
Right. I mean, I think what Sammy says right there is something that I can use that with something inspiration. So AI now is also being used for preventative. Imagine, quickly. We always have to do the history of, what our mother has and what our father has had in terms of, high cholesterol or cancer. So the AI now can manage loads amount of data, right? Read through your history and your family history quickly. So imagine if before you even get the cancer, it just tells you, hey, you're predisposed for X, Y, and Z. So no more waiting until you actually get something and then you're like, oh my God, I can't believe I have this. But being used for preventative care. And not only being used for preventative care, but being used to also quickly diagnose and provide quick medical treatment. That way there's certain things that we see where people die and we're just like, wow, I can't believe that person died of that. How is that even possible? But if we really start leveraging AI to prevent to prevent that and be a guidance to saying this person is the minute the doctor walks in, hey, you're predisposed for this, you're predisposed for that. Here's how we can make sure we keep you on a healthy track. So the power of AI uh, is unlimited, especially when it comes to preventive care and care where everyone, regardless of their sex, their background, their race, has access to equitable care, because now we are assisting doctors with technology take manual labor off their plate that's not necessary, so they can get back that time they need to be more compassionate and kind and actually talk to their patients. How are you today? No, seriously, really, how are you today? And guess what? I have the time to listen to you as your doctor to really understand how you are today. And for me, I think that's what's going to be the power of technology, giving medical professionals more time to be with their patients.
I love it. That is a very strong and positive note to end on, Flo. Because as we are, again, as I mentioned earlier, trying to deal with disparities in care equity, you're right. I think that could be a beautiful solution when we have AI do a lot of the heavy lifting,
Right.
non-essential stuff for the doctor so that they can have time to really give their patient that one-on-one love. Flo, I'm sure we're going to have you back again because we want to talk about DEI and disparities
Yeah.
and other stuff. We'll be back on. Stay back for a little bit. Let me just say goodbye to our audience. And Peter said it was a great point to end on.
Thanks, Peter.
Was equitable care. I totally agree with Peter. That was uplifting. And, again, we'll have you back on. So for now,
Yeah.
guys, we're signing off for Tea Talk. It was so great to have my friend Flo on here today. Learned a
Thank
lot.
you.
Blah.
Thank you, Sarah
Bye.
and Sammy.
Bye.